Good day. My name is Milton Schoen. I'm the Hennepin County Veterans Service Officer, and welcome to America Salutes. Today we have Linda Bloomgren, who's a Senior Coordinator of Volunteers for Volunteers and Community Partnerships at Hennepin County. And welcome to our program, Linda.
Thank you.
And why don't we start by just having you tell us a little bit about what you do to make the lives of people in Hennepin County better.
Well, our volunteer program provides direct service volunteers for clients that are served by the Human Service and Public Health Department. It might be seniors, people with disabilities, children, families, and provide some direct service based on the social worker's case plan. Volunteers also provide transportation for people who don't have access to reliable rides to get to the grocery store, medical appointments, and that kind of thing. In addition, we have donation programs. In the fall, we do a large backpack challenge program. We provide filled backpacks for kids from ages 5 years old through 12th grade. And during the winter holidays, we have a holiday giving program that matches donors in the community with clients who have been referred by their case managers.
Very good. And specifically with veterans, you do a lot of work with veterans, and we have veterans who are starting their life over, who've just gone through treatment. And could you tell us a little bit about some of your activities to help these veterans?
We have several large donors, large donor groups, such as an employee group at Cargill Incorporated, who really want to work with and help the veterans, help them get started again. And they will provide holiday gifts for veterans and their families. They've done personal care kits, gift cards. We've got donors that do the gift cards for the veterans, to help the veterans get back on their feet.
Very good. And many of these folks are just starting life over, that they've made the move to sobriety, and oftentimes they're not connected to people in the community or family. Mm-hmm. So it's important that they know somebody cares about them, especially around the holidays.
Oh, absolutely. And one thing that the donors that work with the veterans have told me is that they feel a real compassion and a real desire to help veterans that have given of themselves to provide safety for our country.
Very good. One of the things is that you get information, and often our staff gets information from these veterans about their specific needs. So you wind up tailoring what you do to meet the specific needs of individuals.
Right. Last year we had a request for tools for a veteran who was getting back into working and needed tools for his job. And so what we did was gave that veteran a gift card for Sears, and he was able to go out and purchase the tools that he needed. The workers, your workers obviously, do provide information. They give us a little background information and then tell us specifically what each veteran needs, and then we send that information on to the donors, and the donors shop for them for the specific things that they've requested.
Very good. And one of the exceptional things is you have families that, as you mentioned, that you're not just helping the veteran, but you may be helping the spouse, you may be helping the children, so that they have a much brighter holiday.
I just got a thank you note back from a veteran and their son. And the little boy said, "Thank you so much for the blanket that you gave me for Christmas. It kept me warm. I don't ever let it down. I take it with me everywhere I go. Thank you for making my holiday happy." And that was just so touching.
And one of the interesting things about your volunteer program is that in some cases it's, like corrections, it's site-based where people just go to an institution, but you are tailoring what you do to meet the needs of individuals, and that's pretty unique.
Our direct service volunteers work with the clients in their homes. We do background checks on them to make sure that we're not placing anyone with a vulnerable client that shouldn't be placed there. And they work with them in their homes, they're friends, they help them with parenting skills, sometimes help them just with life skills and life coaching, and to help them get a better foot also in the community and to connect them. Often our clients are lonely, isolated, have no friends or family, and this is the only social connection that they have in the community is the volunteer.
And so if I'm hearing you right, you have one piece of what you do, which is you might get gift cards or gifts for people, and another piece is getting volunteers who can help somebody to do their shopping, to balance their checkbook, to help them be independent.
Correct. And in addition to that, we have volunteers that are what we call team assistants, and we have those volunteers working on projects. We have greeters now out at our new Northwest Family Service Center. It's manned specifically, totally by volunteers, and they're just doing a great job out there.
So that people coming to that facility are not lost.
You're right. They come in, they make copies for people, copies of their recertification papers and that kind of thing, help them get to the correct facility in the building, the correct agency, because the building is housed, there's 3 different programs that are in there besides Hennepin County.
So this is a customer-focused initiative that you're focusing on the needs of the people that come to the Northwest site for help.
Right.
And
and they might be coming for EBT cards to get recertified for their medical, for their financial assistance, that kind of thing.
And that is a piece of the regionalization, because I realize that the county is moving towards a regional service delivery model. Instead of having everything centralized downtown, we're going to have a number of regional sites where people in their community are able to connect with the services they need.
Right, and the clients, the people that come in really like that idea, not having to drive all the way downtown, find a place to park or take a bus downtown. And people that live out in Brooklyn Park, Brooklyn Center, it's not that easy to get a bus to go downtown, but it's not too difficult to get out to the Northwest Center. So.
And veteran service, we've learned that we're at Brookdale 2 days a month, we're at Ridgedale 2 days a month, and out in Bloomington 2 days a month, and it's a tremendous asset to people. They don't have to drive downtown, and we do a customer survey of everybody who files a claim with us, and the number one issue is people want service in their community closer to where they are.
And the county, like you said, is going towards that regionalization, and there's going to be other sites that are built throughout the county, throughout the metro area.
I would assume that it takes a long time to get organized for some of these specific initiatives, because you've got the holiday giving and you've got to line everybody up ahead of time, and the backpack challenge, it's even earlier in the year. But you have to make sure that a substantial amount of work is done to make this a success.
We are continually recruiting all year long for volunteers to help us as team assistants, for volunteers to help in direct service, to help with the donation programs. And we're also doing marketing to get new donors every year that are willing to support the people in need.
That's very important. And I know that we've got many of the people that are going through a structured independent living program receive help during the holidays from your programs. And then we also have a wide variety of individuals who get some assistance, some help that they need at that time, and that's very important. So if a person wanted to volunteer, if they called your number, the 612-348-9900, is it?
Yes.
Then a person who wanted to volunteer to work with veterans or to work with other people in our community, they would be able to do that, and you'd begin the intake process with them?
Correct. The 348-9900 is our intake number, and those phone calls are answered daily, and they will get called back, and hopefully whoever calls wants to volunteer, wants to be a donor, and we can get them matched up with whatever is appropriate for them.
Very good. And you mentioned a background check. So one of the things that you do is to make sure that if we're dealing with an individual who's vulnerable, that you're protecting them, that we're doing the best job that we can to make sure that if we have a volunteer assigned to them, that they're going to be safe.
That's right. And in addition to the background checks, they're required to do some of the same training that county employees do, the data privacy and professional boundaries training. So before they're ever placed with anyone, we've had quite good success in matching our volunteers with our clients. So.
Very good, but there's
a lot of work.
There's a lot of work to do it right.
Yes.
You could do it quicker, but it might not necessarily be better.
That's right. That's right. So we don't cut corners at all. We make sure everything is done correctly.
Very good. And are you finding that you're getting more volunteers as we move forward, or is it always a constant challenge that people age out and you need to get a new set of volunteers?
It's a continual challenge. And right now we're getting volunteers who are more interested in doing the team assistant, unit assistant kind of work, and we really have a need for the volunteers that want to do direct service and work with the clients. So.
Very good, and help them work their way through
to independence.
To independence, very good. Well, Linda, I want to thank you for informing us about what you do to make the lives of veterans and to make the lives of other people in our community better. And we certainly appreciate what you do and your programs, and I think our listeners will be better for this, and hopefully you'll be getting a few phone calls from people who want to make contributions to our community.
I hope so.
Very good.
Thank you very much for having me.
Very good. Thank you, Linda.
Thank you.